am guessing that there is no community in no city that's any more prepared with the historical documentation of this COVID-19 pandemic than Tuskegee, Alabama, and Tuskegee University. What do you say about that?
I would have to agree, sir. My name is Crystal James. I have the pleasure of serving as the Special Assistant to President Morris at Tuskegee University for COVID-19 recovery. And since the very beginning of the pandemic, we have had our researchers as well as our public health professionals in the community as well as in our laboratories trying to, first of all, make test kits so that we can make testing available as quickly as possible to residents here in the community, but also staying connected in providing health education around mitigation and how to stop the spread. We have been successful in keeping community spread down in Macon County as well as on the campus of Tuskegee University, and it's because of community collaborations like what we're doing here today. We have the National Day of Prayer, and we're here at this event doing COVID-19 testing as well as providing COVID-19 vaccines for those people who would like to get it. We continue to make the most recent information available to our community through our Community Health Task Force, and it is through the collaborations of all of the different non-governmental and governmental organizations that will be important to keeping the spread of COVID-19 at a level that is not going to hurt our communities. Now, we know that this COVID-19 is not going anywhere, and we're going to have to continue to figure out how we can stay safe in this COVID environment. And one of the ways that we do that is continue to wear our masks, continue to help people understand how you can contract it, as well as what the symptoms are, but also providing vaccinations and other things that become available to treat COVID-19 as the pandemic moves forward into an endemic phase.
Now, what caused you guys to, at the university to realize the drastic nature of this pandemic and to get started 2.5 years ago almost to stay up with the pandemic as it moved? What happened on the campus that caused that insight to happen?
Well, it just so happened at the time the pandemic started to take over the United States. The university was being led by then the interim president, Dr. Ruby Perry, who is a veterinarian by training. And this, we know, is a disease that transferred from animals to humans, and we call those zoonotic diseases. And so we have a virologist that's in the College of Veterinary Medicine, as well as other basic scientific researchers to help us to understand that this virus was not the common cold. It was not the flu. This is something very different, that we needed to have a very intentional approach to how we mitigate its spread. So from the beginning, we knew that testing and being able to do isolation and quarantine were going to be critical aspects. And if you can recall, at the beginning of the pandemic, availability of testing was a serious issue around the country. So we turned our laboratories, after we sent our students home, and we got our laboratorians to work into making our own test kits. So we not only had them available for the campus, but we had them available for the community at large. And we even provided some to the state to be able to send out to spaces that really needed them so that people could get tested and be able to isolate and quarantine and not spread the virus. So I think those were some of the critical first steps that we were able to take. And as we continue to learn more and more about how it spread, we began to do sanitizing, put up barriers in spaces where people had offices so that we can limit the amount of droplets that people might be exposed to. And we continue to try to make sure that we are keeping ourselves updated with the latest things that can help our environment. We just ordered a lot of air purifications for our spaces on campus that don't have windows and no natural ventilation, because we do understand as people are in spaces over a long period of time that their air needs to be cleaned or it needs to be ventilated, or that opportunity for the virus to spread increases. So we continue to use all those mitigation strategies to ensure that the campus is safe as well as the community at large.
Now, we had just about lost one of the best links in this community with the university, because there was a time that I read about whereas the town in gown was almost spiritual. So now, when this pandemic jumped in on us, we formed in this community a task force that brought entities from everywhere together.
Absolutely.
How do you grade that brainchild, and how do you grade the work and the cooperation of that task force?
Well, the blessing of the historic community that Tuskegee University sits is that we have a great resource of retired nurses and other healthcare providers that are in the community that are, even as we're doing our research on the virus itself, they're helping to help us understand what's going on clinically. And so having an opportunity on these Saturday meetings to bring all of that knowledge base together, the young, the old, governmental, non-governmental, university researchers, practitioners, nurses, those having that opportunity to share space and to collaborate and share information so that we can then take all of that information and devise what will be the best mitigation strategy, I think has been critical. And I think that task force has reinforced the importance of what an 1890 institution is for, and we were planted and we are in existence in order to serve the community in which we sit. And I think this is one way in which the university is showing up in that space and ensuring that any knowledge that we have there on campus is readily available to the community as well.
And I want to thank you for being so brilliant and so involved in this process. I'm very proud of you.
Thank you very much. I appreciate that.
Thank you, ma'am.
You're welcome.